Hi, good evening. Austin Mayor Steve Adler. Got a minute? All right, we're going to quickly go over the numbers tonight so that you can see the numbers after the weekend when we were gone. Obviously, a lot of stuff were happening with the orders and the like. May touch on that briefly, but mostly I want to get us to Director Hayden, who's Director of Austin Public Health, primarily so that we can talk about the vaccine distribution. Lots of questions in our city right now about those, and I want to make sure we get to those. But let's go ahead and begin with the numbers. My staff has left me in charge of this tonight, even though I'm bringing in Director Hayden. So let's hope that I can do all of these things. This is the main dashboard we take a look at. The first number we always look at are hospital admissions, the red number in the lower left-hand corner. 7-day moving average is 77. Remember, we moved into stage 5 when we went over 50. 84 was the number of admissions that we had in the last 24 hours. That's a high number for us. I think I heard it was a record for us. And that's the concern is the admissions that are coming in. Other concern when we look at this is the number of new cases. It's the white number off to the right, 752 new cases. The 7-day moving average is 537. So obviously that's a real concern. The positivity rate this week we saw from the old numbers were 12.7. I think that's being updated at this point. I don't see it on the chart. There it is, 12.7. I understand from the preliminary results that are coming in, Dr. Escott suggested today that positivity was still going up and thought that the number was probably just south of 15%. But as that positivity rate goes up, the concern obviously continues to rise. The green numbers that are down at the bottom are the 7-day moving averages for hospitalized in our ICUs and on ventilators. Look at the in ICU number. The 7-day moving average is 142. The actual number as we have it here tonight, let me see if I can pull that up here for you to take a look at. And you can see that we have 151. Substantially above our 7-day moving average. Again, ICUs moving in the wrong direction. Recall hospitals told us for planning purposes to assume that they would be able to staff 200 ICU beds. The modeler tells us that we could easily get to 200 beds by the end of the second week in January. We may have a little bit extra staffing that may be coming to us from the state. We are hopeful that that is true. That would help us be able to use more of the ICU beds we have that are not otherwise staffed, but we can't count on that, and we don't have that yet, which is why everybody needs to stay really vigilant with respect to masking and social distancing. This still is crunch time. We're in an uncontrolled spread of the virus. The number of cases we have, 51,956. Which is a number obviously increasing, and the number of people who have passed away now is at 550. The number of people in our hospital right now at 484 is more than the 7-day moving average of 459. So you can see from looking at these numbers that we're still in a pretty dramatic increase. It is now a week to 10 days after we started urging people to change their behaviors. I don't know what we'll see with respect to the holidays. It could be that because of the holidays, people stayed home a little bit more. But if we look at the University of Texas dashboard that we have, you can see the R factor is at 1.16, which would be a little bit lower than what it has been. You can see that hospitalizations, the predicted line, That aquamarine line continues to rise. If we look at ICUs in the area, this line here is 200. You can see that the model right now has us passing 200 just at the end of the second week, beginning of the third week in January. That's the concern that we have. I'm going to now try to take us out of this and bring into the conversation Stephanie Hayden, who is Director of Austin Public Health. Director Hayden, thank you for coming back and joining us.
Thank you, Mayor Adler, for the opportunity to be here this evening.
And I know for a fact, because you've been on the phone with me 24/7, certainly a lot of the Christmas and New Year's Eve holiday, that you didn't get much of a holiday, and neither did your staff. So when you go back, would you please thank them on behalf of the community for the work that they're doing, and the fact that they didn't get much of a holiday.
I will definitely share that with them.
Okay.
Thank you.
So let's talk about vaccinations, because that's really most of the questions that I'm getting right now. And I think that there are two issues that have really gotten kind of public view. One is the fact that the distribution as it's happening is happening at grocery stores and pharmacies, which are mostly on the west side of town, not the east side of town. And the question is, why are we not better geographically distributing vaccines in our community? Why is that not happening? And then the second, the governor very publicly said that if you were over 65, you're now eligible for a vaccine. Except that I'm hearing from a lot of people who are spending all day on the internet trying to find a vaccine at over 65 and can't find it. So I want to talk about those questions and then help people just understand what's happening with vaccine delivery. So with respect to vaccine distribution, what is the city of Austin and Austin Public Health able to do or control? Who else is involved and who's doing what?
Okay. Well, I want to just share with the audience that the Texas Department of State Health Services enrolls providers. And so they are the distributor of the vaccine. They determine how much you will receive and when you will receive it and which vendor it will be sent to. And so Austin Public Health is a provider. And so we don't have any control over who the state of Texas enrolls to provide the vaccine to. And so what we have really worked on, just in general over the years, is leading with an equity lens and making sure that as a safety net provider, that we have a presence in the Eastern Crescent. And so we have fixed locations for our vaccines, but we also have a mobile team. And so we are able to be in the Eastern Crescent to be able to provide the vaccines. Okay. So our goal is that we want to receive more vaccines to our community. And so if we're able to receive more vaccines and to know exactly how many vaccines we're going to receive, because at this point, we don't know how much we're receiving until the day of that they're being shipped to us. And so for planning purposes, if we are able to receive more vaccine, we will definitely provide the vaccine in the Eastern Crescent.
All right, so let me back up for a second, see if I am understanding. There are different organizations and entities in Central Texas, Austin, Travis County, that have been identified and registered as providers. And if and when they get vaccine from the state, who is the distributor, then they have vaccine that they can turn around and then give to people. Is that right?
That is correct.
Austin is one of the providers trying to get vaccine from the state, but we're not the only provider in Central Texas and in Austin, Travis County. Is that right?
That is correct. There's over 300 locations in Austin that are
Yep.
signed up.
Okay, so those 300 locations, there's 300 entities that are trying to get the vaccine. Austin is just one of those 300 entities.
Yes, correct.
The other people that are also entities, Seton Ascension is an entity, St. David's is an entity, and Baylor Scott and White is an entity. But also a local physician who has a practice might be an entity, or a clinic might be an entity if they have signed up and registered with the state to be a provider. Is that correct?
That is correct. Yes.
Who decides which provider in the community gets the distribution of the vaccine?
The Texas Department of State Health Services. They make that decision.
Do we control that? I mean, can we say to the state, you need to give most of it to the 3 hospitals and to us because we're going to give it over in East Austin? Do we get to direct it, or we're just told what our allotment is?
We are told what our allotment is, and that is for every provider.
And we've heard from a lot of the providers that they don't know exactly when they're getting it or not getting it. Sometimes it just shows up to them. Is that right?
That is correct. You may get a call this morning and say you have 100 doses that will be shipped to you today.
And then you start trying to scurry to figure out how it is that provider receives that notice, and then they have to get it out. So when we look at the provider map and where the vaccines have gone, and most of it is on the west side of I-35, that's not a decision that the city of Austin makes or gets to control. That's how the state is distributing it. Is that correct?
That is correct.
And in fairness to the state or the federal government, one of the strategies that they employed was to say, hey, if we get this out to grocery stores and we get this out to pharmacies, that might be a really good way for us to get it out to the community generally, which seems to be kind of the strategy that the state or the federal government has taken. But in a city like Austin, where grocery stores and pharmacies are not equitably located throughout our community, we know we have a history of disparities, and that's shown up just in terms of the people who were susceptible in getting the virus and dealing with it. In our community, that doesn't work. Is there any chance at all that the state will change its strategy and instead of just sending it out to wherever it is that they're sending it out to, with however it is that they're deciding how to send it out, is there a chance that they could come to Austin Public Health and say, would you please, we're going to give it all to you, or we're going to give it to you and the 3 big hospitals. Can you help us distribute this vaccine quickly and equitably?
If the state made that decision, we would gladly accept the vaccine and we will get it out into the community as quickly as possible.
And in fact, Austin Public Health and Dr. Escott and everybody is suggesting and lobbying to the state that would be a better way to get the vaccine out. And I appreciate you doing that, and I wish you the best in trying to get that so that it can get out that way equitably and in a way that's directed. It seems to me that rather than sending it to a physician with a practice, a box of 100 doses, if we could get it to a centralized place, maybe open up one of the ACC campuses on the east side of town, or the Delco Center or something like that, and come in with 1,000 doses, we could vaccinate a lot of people in the areas that are needed most on a regular basis if we could get that supply. Is that the kind of thing that we would do if we had the supply?
We would definitely want to do the large scale distribution to be able to vaccinate a large number of people. But we would also still want to do some smaller locations as well. We're grateful that the transportation bond passed, and we'll be working on transportation. But we know that there are some areas where transportation is not accessible. So we want to be have a presence there as well. The other thing that we would want to continue is that for people that are homebound and not able to come out of their homes, they're disabled, etc. We want to be able to provide that vaccine at home. So we want to be able to, have a large scale, a neighborhood based scale, and an in-home process as well.
Got it. But again, to repeat, at this point, we don't have the vaccine from the state for us to be able to implement that kind of strategy. Is that right?
No, we do not. We don't.
So when the vaccine first came, and it came, some of it to some of the hospitals, and we got a total of about 1,300 came to Austin Public Health doses. Is that right about that amount?
Yes.
Everybody initially was giving it out to the highest category of people based on the national and CDC rankings. And that was to get the vaccine out to those people that were the frontline healthcare workers, the people that were not only essential workers, but were essential workers because they were walking right into the lion's den. They were the people that we were asking to interact and help and protect and treat the people that had the virus. And those were the first place that most of that virus went. Is that correct?
Yes, you are correct, Mayor.
And then the people in our community that are most susceptible and vulnerable of dying if they get the virus, and that are the highest percentage of the highest mortality rates are people that are older, that have comorbidities or other kinds of conditions. It's frequently the people that are in nursing homes. So the next group that got it were the people who were patients in nursing homes, and then the frontline healthcare workers that were dealing with those patients. Is that right?
That is correct. Yes.
And a lot of that distribution is being done directly by CVS and Walgreens. They're going straight out to the nursing homes.
Yes. There are 10 locations that have signed up to receive the vaccine from CVS and Walgreens. Now, there are some smaller long-term care facilities that did not sign up with the state. So Austin Public Health is providing some of that to them this week.
Okay, and good, because they would have otherwise slipped through the cracks. The vaccine that is going to the other nursing homes from CVS and Walgreens, just to go back to what we were talking about a second ago, that's a contract between CVS nationally and the federal government. So Austin Public Health is not party to that contract, can't control that contract, can't tell CVS what to do, because CVS is doing that work and receiving that distribution of vaccines directly from the manufacturer pursuant to a contract that was executed at the national level. Is that correct?
That is correct. It's a federal contract.
So in the middle of this process where our hospitals and everybody's trying to get it out to the healthcare workers first, the frontline health people, the 1A people that are the most desperate and most vulnerable, and the people we want to get it to first, have we gotten the vaccine out in our community from these providers to everybody that are classified that kind of 1A?
To be honest with you, no. Everyone from 1A has not been providing the vaccine. We understand that there's another 40,000 individuals that fall in that category that have not received the vaccine.
These are the 1A people that get it before people over 65. Are they 1A people or 1B people?
They are 1B people.
Okay, so tons more 1A people still don't have it yet. But do we have the data? I mean, are people required to report to us how many vaccines they got and how many they provided to people and who they gave it to and what the demographics are of the people that they've given it to?
No, that is not a requirement. That is a requirement that the state has in place with those providers. And so the state is going to create a dashboard. It is not available at this time. And so our plan is to definitely create a dashboard at the local level, but we need to be able to pull that information from the state's database and then also populate it with the vaccines of the individuals that we provide the vaccine to as well.
And at this point, that information is not available to us for
No.
us to be able to create a dashboard. So we don't know for sure exactly how many vaccines we've actually given out in Central Texas and to who they've gone to.
No, we don't.
Okay. Again, I hope you're successful in getting the state to change the strategy so that we have a better handle of what it is that's happening in the community. All right, so most of it's going to the 1A people, and we still have more 1A people that need to get it. But then I also thought that I saw the governor say that if you were 1B, if you were over 65, that you were also entitled to get the vaccine.
That is correct. That announcement was made last week by the governor and then also by the Texas Department of State Health Services.
Do we have enough vaccine to give it to people, everybody over 65 in our city, county?
No, we do not.
So we still haven't given it to all the 1A people, but yet we have people over 65 now that are going on the internet trying to figure out where it is that they can get the vaccine from. What do we tell those people?
Well, right now we are asking them to reach out to their primary care physician to see if they can go through that process. The other thing that we've shared with them is to go onto our website and look at that information that we have there as well. We are in the process of standing up a pre-registration process that will be up and running next week, because we do want to offer that as well. So individuals may have several places where they could sign up with the potential of getting the vaccine.
But at this point, there's not vaccine to sign up to get.
No, there is not.
Are we dealing with a supply challenge or a implementation challenge?
It's a supply challenge. It's a supply challenge. Most cities have a plan in place of, in case of an emergency, how you would quickly provide vaccines to your community if you need to. And so most communities have that as an emergency plan.
And we have that emergency plan.
Yes, we do.
The only problem right now is the state's not giving it to us to be able to execute our plan. They're distributing it differently. Now, I think that one of the things that the governor said, which I think is really reasonable, is, if you have the vaccine, don't let it go to waste, right? Sometimes if you open up a vial or take it out of the refrigerator, it's going to go bad unless you put it in somebody's arm within a certain period of time. So if they take it out of the refrigerator or they put it together as a compound, whatever it is that they do, and they're injecting it and they're giving it to 1A people, and then they run out of 1A people in their practice, we still expect them then to give it to somebody rather than letting it waste. And that's how some of the 1B people are getting it. Is that right?
That is correct, because if you have people that are in front of you and you don't have the 1A people, you do want to go ahead and provide it, because we want to be able to get as many people to get the vaccine as possible and not let vaccine go to waste.
Okay. So right now we're getting in vaccine. It's going to among 300 different providers. We don't know ahead of time who's going to get it. They don't know ahead of time when they're going to get it. It shows up, and then they give it out to 1A people to the degree that they can, but they don't let it waste so they can give it out to some of the 1B people as well. In the meantime, we look at that and see two things. First is, that's not the most equitable way to distribute the virus, the vaccine. We'd much rather do it geographically and targeted to the people most vulnerable. And second, it's not best way to do it at a high enough volume to be able to vaccinate the greatest number of people as rapidly as we can. So right now, our city, our county, Travis County, is lobbying for a change, and it looks as if the state might be considering that kind of thing. So we'll keep our fingers crossed on that. In the meantime, what should people do if they're over 65 or they have a medical condition that makes them vulnerable? What should they be doing right now?
I think right now, because the vaccine is not widely available, we encourage folks to continue with your wearing your mask, watching your distance, staying home, because if it's not an essential trip, we will prefer that you stay home because vaccine is not widely available. And so we would prefer that you do those things right now. We have our website up that is available. They can go on to austintexas.gov COVID-19 /vaccines and look at information on the website. And there are some physician offices that are establishing a list. And so some of them may be able to get on one of those lists as well. Department of State Health Services has publicized the list of providers. And so they could see that list of providers that are on that list.
Okay. And then I guess at the same time, Austin Public Health is trying to get its hands on more vaccine. And if you were able to find 1,000 doses somewhere, either in a new delivery or, cobbling together some from other people, to the degree that we get it, we're getting it out equitably in the Eastern Crescent to the most vulnerable people, because that's how we're prioritizing everything that we have control over. Is that correct?
That is correct. Yes.
Director Hayden, I think those are all the questions I had. Can you think of anything that the public should know that I didn't know or didn't remember to ask?
Well, I think I know that everyone wants the vaccine and they would love to have it today, which is a great problem for Travis County to have. But we do ask for folks just to please be patient with us and the providers, but definitely visit the website, and that way you can, if there's questions you have, you can get answers to your questions there. They can always reach out 311 and give us a call, because there may be questions that you really have more questions about. And so we welcome those calls as well.
And then tomorrow, you and Dr. Escott are briefing the Travis County Commissioners Court in something that will be publicly available. So if people in the community want to watch your briefing tomorrow morning, you know what time that is?
Yes, we are scheduled to be there. We'll approximately be starting about 10 o'clock. The meeting starts at 9, and so they've asked us to be there at 10 a.m. So Dr. Escott will give his briefing, and then I'll provide a briefing about vaccines and our strategy.
Cool, and that's available. The public can watch that. Those are public meetings. Dr.
Yes.
Hayden, again, thank you so much for coming here on this evening. I know that this is made for an incredibly long day for you, but I think they probably all are. Thanks for what you're doing for the community.
Thank you, Mayor Adler, for the opportunity. Have a good evening.
Okay, take care. I think that's all that we have right now. Please know that we're trying to get the vaccine out just as quickly as we can. There are several hundred providers in the city. We're trying and lobbying to have a more centralized approach so that we can be more strategic in how it's going out, just as Director Hayden discussed. But this is something that the state controls and not us. We're going to try and do absolutely the best we can within those parameters and try as many different ways as we can think of to try to get the vaccination out quickly, but also equitably. It was a long meeting tonight. Sorry about that, but I think Director Hayden was saying stuff that we all needed to hear. With that, you all take care. Good night and be safe.